Good morning, everybody. This is Dr. Rao. I'm opening my room, talks and burnout. And today we're going to talk about the emotional toll that burnout is causing, not only in the physicians, but a lot of workers, right? So I want to give the take what kind of emotional toll people are going through and what can be understood from not only the modern ways but also the ancient ways, and then borrow some wisdom so that we are capable of dealing with this effectively without really going real uh, paying price for it, right? So that's my intention. As you know, let me introduce myself. For those people who do not know, I'm internal medicine physician. Had been practicing for more than 40 some years in the United States, and I've been into informatics. I attained a master's in biomedical informatics. I worked on EMRs and data, and now I established a company called BAPAL, which is really provides services of uh, you know for stress and burnout, and also generally how to enhance the human being by combining or fusing methods from modern medicine and also from the ancient wisdom. So I'm a avid yoga practitioner for a long time, but it's not just yoga, but also systems based on consciousness from the East. One thing comes first about is the non-dual philosophy and yoga philosophy and Ayurveda philosophy, and all these systems of um, thinking and beyond thinking methods that they have. I was very fascinated, and the more I read about these things, and I kind of practice some of the yoga practices, breathing practices, calming the mind, meditation, they led me to more like a equanimous in my mind and in my emotions, and also more healthy in my body. The energy that I feel is phenomenal. So I kind of want to come and share some of it, some of the hacks that will be applicable to modern living, and thereby we all can be really uh, really understand where everything fits in our modern life. It's not like you are going to go back in time, but it's like going to borrow the lessons that they profounded and which are really relevant even to the present day. Okay, so that's what I wanted to present today. I welcome people to come and participate in this discussion. If they have any questions, anything that they would like to ask me, we are more than welcome to come and ask me. But let me tell you how I was seeing this emotional toll in my colleagues or in my colleagues of not only physicians but also other healthcare workers too. Because most of the doctors, most of them that I know, they are there not just for the money, but really help the patient. They get a lot out of that. They find it very meaningful to help the patients and then be servant leaders of their medical care. So once they come into the system, however, they kind of dehumanize you during the residency, and they make you more like a bureaucrat and then a clerk during the clinical rotations. So doctors feel like they are not in charge of the patient care anymore, and that kind of bothers me quite a bit. And sometimes they have to do things that they don't agree with, uh, or at least he doesn't agree with their conscience, right? So that is why all the rub comes. And the other thing is during the residency and medical school, people don't pay attention to doctors developing kind of a ego, according to the accomplishments, scholastic accomplishments, degrees, and knowledge, and all that they develop, they kind of let them get into them and identify with that egoic self. And when they approach with that egoic self to the human relations aspect of patient care and also other people, that ego comes in the way, and people really feel like they're not praised enough, or not really brushed their ego enough, and they also feel bad when somebody else says something insulting, all that kind of thing. We know the dynamics that go through when you develop ego and then you identify your ego as yourself, right? That's, I think, basically happens in all the professions. But close quarters, I saw that in the physicians. Okay, so it's very difficult for them to be the leader of the team of the patient care and not assume that they are doing it, they are responsible, their brilliance, their knowledge, their experience is making the difference, so they take a lot of pride in that. And self-respect is different, but this development of ego, feeling that I am responsible, kind of leads to bad effects. I will tell an example. See, there was a hospital I was working, and there was a lot of orthopedic surgery done. And I was hired more like a informatician and hospitalist. So we have to clear a lot of patients before operation for the um, orthopedics, right? So when we are doing that, sometimes 8 or 10 patients in a day we have to physically clear for them to have surgery. So there was a lot of revenue made because of the orthopedic procedures for the hospital. So they were listening to the orthopedic people, whatever they want, and then thereby they can have good life, but at the same time and a lot of money, and but not really work physically. So they kind of wanted the hospitals to clear the patient and send them to operation theater. He comes and does the operation. Maybe it will take okay, half an hour to 45 minutes, and then he goes off. Then he expects us to take care of the patient in the hospital. We will take care of the medical part, but they were looking for the pain management and therapy needs and all of that too. So that kind of caused problems because we had enormous work, building on more work and more work, when our pay compared to them is very minimal, really. But that's not the question. The question was we were not able to be effective with the patients that are sick in the ICU and other floors too. So the orthopedicians were approached and then presented the problem and then asked them to take more active role in the post-operative management of the patient so that they will be really involved in that. But then the orthopedic people threatened the administration, we will take our business to some other hospital. Nobody have to question us, and whatever we say goes. That is the ego we're talking about, right? So developing the ego and then making everything come around you causes a lot of problems. So there was a lot of confrontation, a lot of argumentation, a lot of energy waste happened because of one particular person's ego, right? So you develop ego, then you're going to have it like a balloon, and somebody comes and puts a needle in it, and your ego bursts, and then you suffer a lot. Lot of emotional toll is because of that. And other thing is expectations. We expect because we are knowledgeable, we have so much experience, we have so much power. Everybody has to roll under and then be um, subservient to us. Okay, it doesn't happen like that. You see, other branches also, physical therapy or occupational therapy or dietary, they also had a lot of training, a lot of hours they put in, so they have their own self-respect too, and they can contribute if you can use them properly because their knowledge is specific and very much related to their branch. They can provide a lot for the patient care. That's what happened. Okay, so that's also another problem why people have so much emotional toll there. And people are ready to come and work from 8 to 5, but then sometimes they dump so much work, so it goes beyond the hours, especially documentation in the EMR, right? So they will not be able to complete their working time, so they take it home because it can be done remotely now. But they will spend a lot of time in the evening documenting all of that, and then they don't have enough sleep or good quality sleep, or they will not eat properly, and all those things come up too. Then when they come in the morning, they are groggy and they are kind of not really effective in that sense. Okay, and emotionally something triggers at the time. It's very difficult to control that too. That happens too. So there are so many reasons people are suffering because of the uh, lack of understanding of how our inner nature works, how our inner emotional turmoil or too much thinking or information overload, all these things act, right? So when they act, people will feel like uh, victims of their own emotions sometimes. They can get depressed, they can get anxious, they can get argumentative, they can develop problems with their own significant other. All these things I'm seeing, so is that really necessary? So when you visit ancient wisdom in this respect, what happens there are systems where they have social support, they have means to fortify yourself emotionally, there are means to develop inner resilience within you so that you can go and face this emotional turmoil that you encounter due to the work or due to the relationship with the work structure or work administration and all that, right? So what I'm going to tell you a couple of things here that really appeal to me, that helped me to put things in perspective in terms of work generated emotional stress, and also work generated problems that can contribute to your problems in your relationship. Okay, so basically your relationships are suffering, right? That's what it is. So there are ways of living that were defined thousands of years ago. Not that you have to do this way of living, but then they observed how human beings live. You know, they said either they live for the pleasure, or they live for earning something, or expanding themselves, or engage in something, or they kind of work in a moral or immoral way, or they can they work for something beyond this life and this thought, and you can call it nirvana, or they call it moksha. So they're named as dharmartha kama moksha. Okay, that means you do everything in a moral way, in a righteous way. You can engage in earning money or earning degrees and all of that, but sooner or later they feel like they are not really meaningful, and then you can have desires that are legitimate, that you can fulfill, but then fulfilling the desires after a while loses its luster too, and then you want to look for something else, right? And the fourth one, which is the important one, is how can you go beyond this thought mechanism and be relieved of this, and then be quiet and peaceful and happy within, and that they call moksha. That's okay, a release or liberation from this kind of mental anguish, suffering, and all that. Okay, so Buddha said suffering is there, but dwelling in suffering and then complaining about it is not the way, but finding that which is beyond suffering and go and stay there, that is the nirvana, and then your mind will be still, and you are peaceful, and you are loving and kind, and you generate a lot of happiness within you, and it spreads around you also. So that's what I think made a change for me, and then understanding that happiness within, and going for the happiness, and then really uh, doing everything because of happiness directed towards the right way, which is inward. Okay, So that is what I learned from the ancient wisdom, which I bring into the emotional toil resolution of our doctors who are burning out. Okay, that means you really have to pause and you have to see, is this all that I'm thinking is me, or is there something beyond my what I'm thinking about myself? And then you can see there is a witness of your thoughts, and that is really you. So the moment you become the witness, suppose you are emotionally upset or emotionally depressed or anxious or any of those states, then you can watch them as an observer. Then you can manage those states much better than really saying that, oh, okay, I'm going to succumb to this and I'm going to develop negativism, and then I'm going to pay a price for it. Okay, because the mind, the way it works, if you build on positivity, if you have optimism and hope, it gets more positive. But if you go into negativity and go spiraling down into the depression, it leads to suicide and other severe problems too. So that's why you have to understand how you are thinking. A stronger thinking is emotion, the feelings that come up and all that, how it is. So their structure is, if you unconsciously think something, that will come and go into your subconscious and settle down there. But if you are consciously thinking, that means you think something, you do that, what is needed for that, and then let it go completely out of you, not settle down in your subconscious mind. Feelings are the same thing too. If you have positive feeling, if you are emotionally, you are trying to forgive people, you try to be grateful that you have this opportunity to serve people, you will be able to build more positivity within you, and that positivity results in more positivity, and then you will be rolling in life. It's how you take it. What attitude you take whatever comes to you in a negative form. Okay, that kind of thing. So all these considerations were there for thousands of years in ancient cultures, right? They had a society structure where you contribute to the society, not just for yourself. You have a big family, you kind of contribute to the family rather than the other people too. So that kind of having this sense of family all over, like they call it Vasudhaiva Kutumbakam. The entire human beings or living creatures are my family. And so if you approach that with other patients or other people that are working with you, because we are all in one energy, right? Once you have that sense of I'm doing for my own family, I'm doing for myself, that kind of thing really helps you to work for an institution or medical field as a whole, or the patients that are presented for your services. Okay, that kind of thing. Okay, so think about that. Those four ways of living, and there was a professor Seligman. He has done something with this system, and he was very jovial person, uh, very humorous person, right? So he had an interview one time with CNN, and CNN said, "Oh, we have to be very brief and clear on CNN. You cannot go for a long time talking about it." So they said, um, uh, "What is the effect of psychological field on the people?" And then he said, "Good." Oh, no, 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 just one word is not enough. I had to at least two words, Then we asked them again, what is the psychology movement effect on our mental health? Then he said, not good, you know. And they said, no, 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 that's two different statements. You are saying opposite, but tell us more clearly. He said, not good enough. And then he talked about pleasure, engagement, and meaningful activity. So, what he talked about was positive psychology of inner resources that human beings have. How can we bring them out? Inner resources of psychological resolve, positivity, um, resilience, that we talk about, resilience we talk about, and hope, gratitude, general feeling of well-being. All those things are there in human beings, right? How can you bring them out? How can you make somebody from being gloom to being more optimistic, more generating energy to other people? Their very presence brings out the energy, right? How do you do that? He went on describing that, and then um, take for example, you are watching football game on the TV, and you are involved in the pleasure of seeing the football game, right? So is that enough, or you get more pleasure if you go out and take a ball and play with kids, right? Lots of people will say that when you play and engage in the play, you feel much more pleasure than just watching it, right? That's what he talked about. And then suppose you are playing a football game for charity, where because you are playing the game and the people are donating money for a cause, and then you feel like you are contributing something meaningful to a cause, right? You feel much better. So he did an experiment with some students, an American students. He said, let's do one thing. Let's take off this afternoon and go to a movie. So they are happy and they went there. And then after they came from the movie, they asked the students, how do you feel about it? What is your rating and all? How do you feel about how you felt about it? Your pleasure and all. And then a couple of days later, he said, "Oh, we are going to take the afternoon off." They said, "Oh, we're going to another movie." No, no, no. We are going to a part of town where a lot of poor people are there. We're going to distribute some clothing, some services to them. Okay, so they went to an orphanage and then took the kids and then gave them bath and then gave them all the clothes and they served them, right? And then after coming home, he asked them write their experience, how they felt. They kind of gave the input. And then 3 months later, he wanted to recall both the experience of the movie and also the experience of serving the orphanage. And he asked them, "How do you feel now? Which one you retain?" Obviously, most of the people forgot about the movie, and they were reporting very pleasant experience with serving those kids. So the people are they're having the pleasure, but they're engaged, and also that was meaningful for them, right? So that is what is missing in modern life is people are going for either what is that karma is pleasure, right? Not desire, right? Second one is they're going for artha, that is accumulation of money, things and studies and all these statuses, all the uh, name and fame and all that, right? But at the end of it, they may be happy for a while, but sooner or later they'll discover there is a void. You can take an Oscar winning actress, you can take a Nobel Prize winning scientist, anybody. After they got it, it doesn't seem that much. It is gone away. Unless they are egotistical and they are really banking everything on that, and that's going to burst sooner or later. Okay? Either way, your long term peace and happiness depends not on the external thing. Somerset Maugham said, if you pursue pleasure with a single-minded purpose, very soon even nothing will be pleasing to you. See, that's a quote he said. That is exactly true. But this particular insight was given by the ancient wisdom thousands of years ago. That's all I'm saying. So we can borrow that. We can put in more engagement in our work and more meaning in our. For example, I'm a doctor. I'm going to work for the relief of suffering of anybody, right? Either they come to the clinic or come to the online now, or they just reach out to me in the DM. The basic thing is they have some problem, either physical, psychological, something like that, and they present that. So that's my opportunity to serve the what we call the divinity in everybody, right? That kind of attitude, that kind of gives me very engaged, meaningful activity for me, and I'm grateful. I'm really uh, really uh, gratitude towards the life to give me that kind of opportunity, give me the health to be able to do that, and to have this attitude of service. All those things are given to me as uh, blessings, right? B.K. Iyengar, the famous yoga teacher, he was doing so many demonstrations in Europe at one time. I think he almost did 10,000 demonstrations, no charge, nothing, just to help people to see what yoga can do to our body and mind and spirit, right? So he was doing a wonderful demonstration, right? But every time he did a demonstration, every time he did a asana, in fact, he did like an hour and a half too, like a 30, 40 asanas in a very nicely. Each asana he considered as a offering to his God. So he was doing with a devotion, he was doing with a purpose, right? It's very meaningful. Afterward, you see, he had millions of followers now, and at one time when he was alive, I know that he had like a 13 million followers in United States alone. Around the world, he had much more. Okay, so but his yoga persists Iyengar way of yoga, and a lot of people gain physical health, and then advance to mental health and spiritual health later. So that is what I want to say. When you perform everything, excuse me. So when you perform everything with that kind of spirit, it has more engagement and more meaning too. So you can do things, artha, gain money for your needs, but do it in a moral way. That's the artha. That's the dharma. Okay, do artha in a dharma way. That means earn money in a moral way. And karma is these desires, you can fulfill them, but then you'll find the emptiness after a while. But when you fulfill them also, you do it in a dharma way. That means desire in a moral way. Okay, and beyond these two activities of desire fulfilling and also accumulation of things, there is something called liberation from your own activity of mind, from your own activity of ego. Because basically, you are not the ego, you are that behind the body and mind, right? Once you identify that, then you can go and work in any hospital, anywhere, without the tension, because without the emotional toll, because you are giving in a very rich way, and then people will appreciate your kindness, your compassion, your sense of service, and all those things will have an impact, no doubt. That's why I'm telling my physician friends whom I train for the burnout, reconsider your attitude. What kind of attitude you are going to the work? Are you going for the just make some money or make some name, or are you really appreciating the opportunity that is presented to you to serve? Okay, so that kind of attitude really helped them to not to be egotistical but to be service oriented person, and servant leadership I call it, so once you are like that, then you do very well, and also you don't allow your ego to go up, so that it won't come down. So you are protected from the emotional toll, so uh, that's what I wanted to tell for today. So with anybody, I think there's only one person here. I will ask him to come up. If he wants to come up and talk, I can say some more things. Otherwise, in the few minutes, I'll be closing this room down. So I think I did convey what I wanted to say. Hi. Yes. How are you? Uh, yeah. What do you think? What I was saying? I mean, it's something that's going on. I see this emotional toll in the burnout, not only among doctors, other workers too. That's why. I'm doing this series. Hopefully, we will invite more people. I didn't invite anybody, but I just opened it. So, but yeah, yeah, yeah. Yeah, yeah. General health is going because people are not working on themselves. They don't have time for the self care, or they don't pay attention to it. They don't eat well, they don't sleep well, they don't exercise, and then they kind of allow these burdens to build up on them by their negative thinking and all. So I'm kind of preach like build up yourself in the morning, get your internal resilience, and then go and face the life. You know um, yeah, but that's such a simple thing. But they don't. You know what? That's what we do in our wellness club. We have wellness club in the morning and evening. When the people come, I make them be here and now. I tell them we are going to be here and now, and then we are going to cultivate their presence all through the hour. Deep breathe, do the exercises, and do the focusing of the mind, and then go to work or whatever you do. Take that focus, take that presence, take that energy that you cultivated. Then you will not be reacting so badly. Otherwise, if you are weak and if you are really already kind of frayed your nerves with the lack of sleep, with all this, then the things happen automatically, and then they react very quickly. I saw people, my colleagues, throwing the charts, yelling at people, and all that. That's counterproductive, and the people yeah, will not appreciate that, right? And then they build the stress like that. Not only for everybody, for themselves too. That's why I tell them, try to be responding to things. Don't react internally. That's the emotional toll I'm talking about. People um, make some incident in the morning and they carry it to the afternoon and to the evening and to the night and take it out on the poor wife or poor husband whoever is waiting at home. And then that's also not good, right? Yeah, yeah. Very important. Very important. I know that's also helps your body clock too. A lot of people drink a lot of tea and coffee on late night and then they sleep and they don't have proper sleep. So if you wake up in the morning, they're not fresh, they're not ready to go. Only for special days they may do. But this lifestyle is also doing that. Why can't we have a bit control on the late night entertainment and reserve it for the weekend when we don't have to get up in the morning, something like that. So yeah. Actually, I tell very simple thing. Don't uh, let the devices sleep with you, but put them to sleep 1 hour before you go to sleep. And in the morning, don't wake them up right away. 1 hour after you wake up, first stabilize yourself and then get into the media or email or whatever. you know, that's a big problem these days, right? Information overload and too many devices. And then people are addicted to their phones. Even in my own house, my daughter and other people, I see they are. It's very difficult to get them off it. But at least they do the routines of physical exercise, diet, and walking, and then going to sleep at a decent hour. You know, so it's a culture effect. It's out there. Whether we want to protect them or not, they will go into that. So I kind of try to tell them nicely, and slowly they will understand. I hope. Yeah. Yeah. I mean, that's the problem because they are introducing these kids right from the babies. These kids are neurologically wired completely different. you know. Yeah. 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 That's why I tell them. Yeah. Yeah. That- that's why I tell them. social media job is to create distractions for us. That's how they kind of get our attention and get advertisement, everything, right? So you got to be careful about that, and then you pay attention to what you want to pay, which is meaningful for you. You know, uh, like I deal with the email. Like when can I really have the email important? I reach out to the people that are important to me, to my work, and to my family, and all that. I don't to study everything under the sun that's going on unless very important. Like in the morning I may see CNBC sometimes, and in the evening I see public channel. That gives me all the information that I need. What is happening in the world, right? Entertainment news, sports news, and all these things are kind of crowd us. We can have too much information in our minds all the time. Yeah, yeah. We will close. We are already done with the 30 minutes. I think people listen to the recording. That's why I do it even if somebody comes or not. If I do a good, yeah, a good job of inviting, probably people will come too. It will be nice if they come and have them questions and discussion. That's also there. Okay. All right, Tristan. I'll see you next time. Okay. I'll do it tomorrow also. We will go from there. Okay. Okay. See you.